for a discussion on the effects of smoking, we're now joined in studio by two special guests. First is Dr. Murumisi, who's a pulmonologist and head of ICU at Helen Joseph Hospital. And then we have Dr. Duvern Ramiah, who's a radiation oncologist from the Sentinel Oncology Center. Gentlemen, welcome to Health Talk.
Thank you.
We've seen those inserts, some of them hilarious, some of them quite serious. This thing that may look cool to some, that bends in people's, lips, as it were, contains dangerous chemicals. Can you perhaps, Dr. Bukasi, take us through the effects that cigarette smoking can have on our respiratory system, perhaps from the lips, where you have it on, right up to the lungs?
Okay. Good morning to the listeners. Cigarette smoking can cause a few diseases from the mouth right up to the airways, as you said.
Yeah.
And they are basically grouped into inflammation, into cancers, and maybe into infections. So cancers like cancer of the mouth, cancer of the throat, and cancer of the lung are the common things that you get. And you can get infection because smoking paralyzes the clearance mechanism of the bugs and everything in the airway.
Yeah.
And then you're prone to the common things that we usually get, the pneumonia and the TB and other infections that you may get.
Yeah.
And then the other thing is inflammation, like you get COPD,
Yeah.
where you get inflammation of the airway. And
Okay, so clearly, I mean, we worry about the cancer, because it's got a very serious connotation that people may actually die from it. Dr. Ramiah, you work at the oncology center. You obviously see people at the late stages that already have cancer. Can you perhaps take us through some of those common cancers that you see associated with smoking?
Well, the main one when you think about smoking is you think lung cancer. And,
Right.
and definitely smoking causes about 90% of lung cancer.
Right.
There's the unlucky 10% of people who don't smoke who get it. But that, a lot of it can be associated with secondary smoking, living
Right.
with somebody who smokes and, secondary inhalation of smoke.
Right.
Then there's also the cancers in the head and neck area,
Yeah.
throat cancer, mouth cancer. And then, there's other ones that are widely associated with smoking as well. Things like pancreatic cancer, so cancer of the stomach, bladder
Right.
cancer. They all associated with smoking as well, and smoking is the major cause of those.
Yeah.
And from what we see, in the oncology center, about a third of the patients that have cancer can directly link smoking as the cause of their cancer. So 1 in 3 people, get cancer because of smoking. So if you stop smoking,
Yeah.
you're reducing your chances of getting cancer hugely.
So there's a very strong association then between smoking and development of cancer.
Definitely.
I mean, you get these people who say, listen, my forefathers and my grandfathers and my father had been smokers for many, many years, and none of them had cancer, so why do you say that I'm going to get cancer?
Look, in the past, I think a lot of cancers were undetected.
Yeah.
So they may have very well had cancer and it was never picked up.
Right.
The other thing is that people are living longer these days. So they're not dying at a young age. So they're living a bit longer and developing these cancers and other diseases which people did die from in the past. Things like
Yeah.
pneumonias and various infections, even cardiac diseases. People are not dying from those anymore. So they're developing cancers, and and unfortunately, a lot of times do die from them. We're able to help and cure a lot of them,
Okay.
but a lot of them, if they're picked up late, unfortunately,
We'll get back to treatment. Dr. Mugasi, let's just focus on the clinical features of these cancers, throat cancer and lung cancer. What is it that people can see to alert them to the possibility of, developing these cancers?
obviously the problem with it is that like the lung cancer can present like any other cancer, like any other disease of the airway. So you
Yeah.
have the cough, you have the breath difficulty, you perhaps would lose weight, which is really significant, and you may cough out blood. Sometimes you have nothing that you cough out, so you're not sure whether there is a problem or not. And all the other non-specific things that are there,
Yeah.
and you may have difficulty in swallowing as well, depending on what way it is in the airway and the swallowing pipe,
Right.
and whether there is pressure effect on the swallowing pipe or not.
Yeah.
But
And at what age do people get these cancers generally?
In the main, they're supposed to be in the middle age of their life,
Right.
but you can get it anywhere
Earlier.
earlier in any
Right.
time, depending on when you started smoking and whether you know you have the genes that predispose you to it, and whether perhaps you work in the environment that has, or you were born in the environment that has risk factors like asbestos and silica, or even coal dust, or
Right.
even pollution from biomass fuel. So there is a lot of factors that come into when you have it and how you have it.
Right. But in terms of prognosis now, I mean, is there hope for some of these people that, you know, develop these cancers over time?
You know, there definitely is hope. You know, the important thing is that it's picked up early.
Mm-hmm.
So like Dr. Mkanzi was saying, you know, if you need to, you know, if you have something, if you're a smoker and you have a symptom which you think may be problematic, you know, generally go and get it checked out. So if you're having throat pain and it's not going away with antibiotics, definitely, you know, go and have that checked. Because you want to pick it up early before you get other symptoms like the, you know, from the spread of the cancer.
Mm-hmm.
But you know, once it's at an advanced stage, you know, then you're going to probably need surgery, which is going to have problems, you know, associated with it. It may affect your speech, it may affect your breathing, it affects your swallowing. So you know, your quality of life definitely goes down.
Yeah, I mean, we'll talk about that. I mean, we heard somebody refer to stage 2 or something of the cancer. I would imagine this is staged according to how widespread it is, isn't it so?
Yes, the stage 2 is a relatively early stage.
Yeah.
When it comes to throat cancer and it's in the voice box, it means it's still confined to the voice box, and that is still a very curable cancer.
Yeah.
Once it goes beyond that, then you get into the stage 3s, which is basically it's gone into the other organs in the throat, and stage 4 means that it's basically spread to other organs around the body.
And the effects are quite devastating. I mean, we saw that people can't even talk; they lose, you know, the ability to speak and to swallow.
Yeah.
But I'm afraid we're going to have to leave it there because we've run out of time for now. We're going to go for a short break. We say thank you to Dr. Ramiah, who's a specialist oncologist from the Senton Oncology Center. When we come back, we continue our discussion on Spoken. Please stay with us.